Placenta eruption, a term uncommonly mentioned, yet a very simplest complication of pregnancy. We often know that during the 9 months of pregnancy, the mother has to take good care of herself, and any complications, if at all, would arise during delivery itself. However, many things can happen during these 9 months, one of which being the eruption of the placenta. The placenta develops in the uterus during pregnancy. It attaches to the wall of the uterus and supplies the baby with glucose and oxygen, with transporting carbon dioxide and urea from the baby to the mother. Abruptio placentae occurs when the placenta separates from the inner wall of the uterus before delivery. This separation is usually caused by the degeneration of the uterine arteries that supply blood to the placenta. These diseased vessels rupture, causing hemorrhage or heavy bleeding, which in turn can decrease or block the baby's supply of oxygen and nutrients. Placenta abruption can be classified as partial or complete, depending on the degree of separation from the uterine wall. It often happens suddenly. This usually happens after about 20 weeks of gestation and affects 0.5 to 1% of pregnancies worldwide. It is diagnosed by exclusion, that is the ruling out of other possible problems. In this case, using ultrasound, placenta previa, or the attachment of the placenta in the uterus in an abnormal position, is ruled out. Left untreated, it can endanger both the mother and the baby. Placenta abruption is the reason for about 15% of infant deaths around the time of birth. So in this setup, the egg will represent the placenta, the sticks and straws will represent the uterine arteries, the bowl will represent the uterus, and the water will represent the blood. So in placenta eruption, the uterine arteries will degenerate and break off. Causing hemorrhage, which will make the blood volume decrease. So in the early stages of placenta eruption, there may be no symptoms, but when they do develop, they tend to develop suddenly. Common symptoms include sudden onset abdominal and back pain, as the uterus would tense up and become rigid as a strong muscular layer contracts to clamp down on the uterine vessels to reduce the bleeding. Uterine contractions that seem continuous and do not stop, an enlarged uterus disproportionate to the gestational age of the fetus, decreased fetal movement, amniotic fluid volume or oleohydramnios, and fetal heart rate, and disseminated intravascular coagulation or DIC, which is the formation of blood clots throughout the body, blocking the blood vessels, leading to chest pain and shortness of breath. This is because the decidua basalis, or the layer of the mother's blood, is rich in thromboplastin, so an eruption would release it and cause widespread coagulation. Vaginal bleeding is the most common symptom, though it is possible for the blood to become trapped inside the uterus, so even with a severe placenta eruption, there might not be any visible bleeding. In some cases, placenta eruption develops slowly, which can cause only light, intermittent vaginal bleeding. The amount of vaginal bleeding can vary greatly, and doesn't necessarily indicate how much of the placenta has become separated from the uterus. If it occurs, the blood may be bright or dark red. So the causes of the placenta eruption is often unknown. Possible causes can include trauma or injury to the abdomen from a car accident to a fall, or rapid loss of amniotic fluid that surrounds and cushions the baby in the uterus from physical damage. The placenta is less elastic than the uterus, so strong forces from traumatic events can cause the placenta to shear away from the elastic wall. So factors that can increase the risk of placenta eruption include placenta eruption in a previous pregnancy that wasn't caused by abdominal trauma, chronic high blood pressure or hypertension, hypertension-related problems during pregnancy, including preeclampsia, which is the high blood pressure, fluid retention or edema, protein in the urine or proteinuria, and the HELLP syndrome, or the breaking down of red blood cells in the blood, a fall or other type of blow to the abdomen, smoking, cocaine, and methamphetamine use, which causes significant vasoconstriction of the placenta blood vessels and hence an abrupt increase in blood pressure. Early and prolonged, often more than 24 hours, rupture of membranes, which causes amniotic fluid leakage, infection inside the uterus during pregnancy, or chorioamnionitis. old age, like being older than 35, a short umbilical cord, and thrombophilia, or the imbalance of naturally occurring blood clotting proteins. So placental abruption can cause life-threatening problems for both mother and baby. For the mother, shock due to blood loss, blood clotting problems, failure of the kidneys or other organs resulting from blood loss, severe cases of shock affecting other organs such as the liver, kidney, and pituitary gland, bleeding through the uterine muscle and into the mother's abdominal cavity, a condition called convolular uterus, and death can all occur. For the baby, it might suffer from limited growth from not getting enough nutrients resulting in low birth weight, not getting enough oxygen and hence developing asphyxia, premature birth, or even stillbirth. So treatment would depend on the amount of blood loss and the status of the fetus. If the fetus is less than 36 weeks old and neither mother nor fetus are in any distress, then they may simply be monitored in the hospital until a change in condition or fetal maturity, whichever comes first. However, immediate delivery of the fetus may be required if the fetus is mature or if the fetus or mother is in distress. Blood volume replacement to maintain blood pressure and blood plasma replacement to maintain fibrinogen levels may be needed. Vaginal birth is usually preferred over caesarean section unless there is fetal distress. That's because C-section carries an increased risk of DIC. The mother and the baby will be monitored for 7 days for postpartum or post-delivery hemorrhage. Excessive bleeding from the uterus may necessitate hysterectomy or the surgical removal of the uterus and other surrounding structures. The mother may require a blood transfusion to replenish the lost blood or medication to help her uterus contract. Placental abruption cannot be prevented, but certain risk factors can be decreased. For example, the mother should not smoke or use illegal drugs such as cocaine. If the mother has high blood pressure or had an incident of placental abruption previously, she should work with a healthcare provider to monitor the condition and reduce the risk of it occurring again. In the vehicle, the mother should take care to wear a seatbelt to reduce the chance of physical trauma. The risk of placental abruption can be reduced by maintaining a good diet, including taking folate, regular sleep patterns, and the correction of pregnancy-induced hypertension. In conclusion, placental abruption may not be well heard of, but it is a serious issue. We would not normally hear of it as it is not popularized in the arts, media, nor culture. We are lucky that we are born without complications and that we have our mothers to take care of us when we are young. Thank you, and I hope that this video has given you an insight into placental abruption.